Okay. Yes.
Thank you for this opportunity to speak to you. I'm David Hogberg, Senior Fellow at the National Center for Public Policy Research. And today I'm representing my colleague at the National Center, Amy Ridenour, who is a Humana shareholder. Mr. Broussard, in January you said the health insurance exchanges created by the Affordable Care Act are probably a good thing, despite admitting that they have some bumps and that the company could take some losses and that the verdict's out on whether enough young, healthy folks will sign up as needed to keep the program viable. One part of the law is the risk corridor, an ObamaCare device that could lead to a taxpayer bailout of companies like Humana. The risk corridor requires companies that make a profit on the exchanges to use some of those profits to help insurers who take a loss on the exchanges. However, if there are more insurers who are losers on the exchange than there are ones who make a profit, the taxpayers then step in to help the insurers who have incurred losses. Thus far, the Congressional Budget Office predicts that the risk corridors won't cost taxpayers any money, but of course the CBO has been wrong in its predictions before. In February, Forbes reported that Humana planned to take between $250 and $450 million from the risk adjustment mechanisms in Obamacare, including the risk corridor. Then in March, the Obama administration proposed changes to the ACA that may increase this potential bailout for insurers in 2015 by ballooning the amount that taxpayers may have to pay insurers for company losses. Taxpayers are already on the hook for so much of this law. So my question to you is, if the situation arises where Humana qualifies for taxpayer money through the risk corridor, can we get your promise that you will reject it?
No, we will not make that promise. I think as a supporter of our members and continuing to strive to ensure that our members have an affordable plan, it's one of the opportunities that is presented in being able to fulfill that. One side comment to that, I think that's an important aspect, is that as a result of the Affordable Care Act, that there is a significant industry fee that is helping support the particular reinsurance that you're referring to and risk corridors and so on. And that insurance fee for Humana this year was close to $700 million. That is not a tax-deductible expense. So in some ways, that particular reinsurance and all the corridors that you were referring to is actually financed by the industry overall. So, but thank you for your question.